All right, welcome. Today we're tackling a really important and, let's be honest, pretty sensitive topic: medical testing. Specifically, we're going to look at the rules for HIV testing in Japan and, well, the pretty surprising times when those rules don't quite apply the way you'd think. So, let's just get right to it with the big question, the one this whole thing is really about. It sounds pretty alarming, right? But the truth is, the answer isn't a simple yes or no. It's complicated. And to really get it, we first have to understand how things are supposed to work. Okay, so before we dive into all the exceptions and the gray areas, let's just set the stage. What's the baseline? There is a really clear, legally required standard for how this is all supposed to go down in Japan. And it's all built on one single fundamental principle in medicine. And that principle is informed consent. I mean, this is the absolute cornerstone of medical ethics, not just in Japan, but everywhere. It basically means you, the patient, have the right to get a full, clear explanation of what's going on, the facts, the risks, everything, before you agree to anything. So, in a perfect world, the process is super straightforward. It looks exactly like this. The doctor explains why they think a test is needed. You give your explicit, yes, I agree, consent. Then, and only then, the test gets done. And finally, the results are given directly to you and nobody else, in private. And look, this standard procedure, it's used all the time in the most common situations. You go to an STD clinic, you're donating blood, or maybe you're doing an optional prenatal screening. In all these cases, this clear consent-first process is absolutely the rule, no question. Okay, so now we're getting to the real core of our question. If informed consent is the gold standard, when, and more importantly, why would anyone ever bypass it? And this slide, this really breaks it down perfectly. What we see is that testing basically follows two different paths. The first one is what we'll call patient-driven. That's when you ask for it, for your own health, your own peace of mind. But then there's this whole other track, the safety-driven path. And that's all about protecting the medical staff, other patients, in those high-risk situations. And it's on that path where the rules start to get a little flexible. Now, it's really, really important to get this straight. We are not talking about some rogue doctor doing secret tests here. That's not what this is. These are legally sanctioned exceptions. They're triggered by very specific, often life or death circumstances, where the focus has to shift from one person's consent to the safety of the entire group. So why do these exceptions even exist? What's the logic? Well, it almost always comes down to one thing: safety. Specifically, protecting the health and safety of the doctors and nurses who are, let's not forget, in the middle of trying to save someone's life. And the material we're looking at is super clear about this. It points to 4 key scenarios where that standard informed consent process we just talked about, well, it might get bypassed. So let's break them down one by one. First up, the most urgent, most dramatic case, an emergency room situation. Imagine a patient is brought in, they're unconscious, maybe bleeding heavily after a bad accident. The medical team's first job is obviously to save that patient, but they also have a huge responsibility to protect themselves and everyone else in the hospital from potential infection. They can't exactly wake the patient up to ask for consent, right? So they have to fall back on emergency protocols. And the reason it's so urgent is because of something called PEP, that's post-exposure prophylaxis. See, if a surgeon or a nurse gets accidentally stuck with a needle or exposed to the patient's blood, they have a tiny window of time, we're talking just hours, to start taking medicine that can prevent them from getting infected. To make that call, they have to know the patient's HIV status, like right now. Okay, the second scenario is a lot more common and, frankly, a bit more subtle. So before you have a big surgery, you'll almost always sign a consent form for a general infection check. But here's the thing you might not realize. An HIV test is often just bundled in there, right alongside tests for things like hepatitis. The main reason is to protect the surgical team. It's not singled out, partly to make things efficient, but also to avoid causing extra stress or anxiety for the patient right before an operation. So you can see how all of this creates a really tough ethical dilemma, right? Doctors and nurses are basically walking this constant tightrope. On one side, you have the fundamental rights of the individual patient, and on the other, you have the duty to keep the staff and the public safe. It's a tricky balance. This table does a fantastic job of summing it all up. You can see each case, the reason for the test, and what happens with consent and notification. Check out that term inclusive for surgery and prenatal screening. That's that bundled consent we were just talking about. And notice the big pattern here. In those emergency situations where consent is skipped, the patient is always told later. And here's the most important part. Even if they don't go out of their way to tell you about a negative result from a screening, a positive result is always communicated to the patient. And this quote just hits the nail on the head, doesn't it? It gets right to the core of the issue. Every single one of these exceptions is a moment where the system has to make a tough call, that the risk to the group, to society, outweighs the standard rights of the individual. It's a really difficult calculation, but sometimes it's a necessary one. So, after all that, what are the main things to take away from this? Okay, first, explicit, informed consent is still the gold standard. That hasn't changed. Second, these exceptions aren't some shady loophole. They are legally defined official measures for emergency situations. Third, and this is crucial, a positive result is never kept secret from a patient. And finally, when push comes to shove in a real crisis, the whole system is built to put the safety of everyone in that environment first. And we want to leave you with this final thought to chew on. At the end of the day, this isn't just about one specific test in one country. It's about a massive, fundamental question in medical ethics. Where do we draw that line between an individual's right to know and the system's need to protect? The way it's done in Japan is just one answer, one attempt at finding that incredibly difficult, delicate balance. Thanks for joining us for this.